Hello, my name is Natalie Gregg, and I'm host of the podcast, It's Complicated. This podcast is about complex divorce and child custody cases, slaying the dragons, taking on your ex in court, and keeping your most precious asset, your children, healthy throughout this process. Today, I have Dr. Grace Graham, and she's going to give us some tips on finding the right therapist for your child in litigation and how to give your child a voice in court. Dr. Grace Graham is a seasoned clinical psychologist of 30 years, and she's a forensic expert witness in family court. She works both in the clinic as a counselor and on the witness stand as an expert. She deals with children in her clinic with patients struggling with tough issues of divorce, including parental alienation, anxiety, and depression from coping with a difficult period of time, and she helps families heal. Welcome to our show, Dr. Grace Graham.
Thank you.
So could you tell folks out there who are just starting this process out, they just filed for divorce, and they have little ones, and they're concerned about their kids' mental health and how they're going to be through this really tough time?
Yeah, well, thank you for asking. I think, it is indeed a very difficult thing to go through a divorce, and it is indeed, good that parents who are going through this very difficult time are aware that their children have very special needs too during this time, because the family that they know, as it was, is going away, and there's a lot of anxiety and not knowing what to expect. And to find them someone that they can feel comfortable to confide in is extremely important.
So I know a lot of our clients will go and they'll go on Facebook, moms groups, or they'll go and they'll ask a friend and they'll say, who's the best child therapist out there? What either websites or materials or what suggestions do you have in searching for a clinical therapist specifically throughout the divorce process?
Yeah, first of all, I think not all therapists would like to engage with the court system. A lot of them, the minute they hear that the family is going through the process of a divorce, they immediately fret the possibility of being subpoenaed or being deposed. So a lot of them would want to turn them down.
Are you saying that some therapists don't like us lawyers?
I think they feel intimidated. They feel very intimidated
Sure.
by the process. And so, that a lot of parents confided in me that that's one of the difficulty. Of course, a lot of them prefer to find someone in their insurance network. Unfortunately, a lot of seasoned therapists who are comfortable testifying in court do not accept insurance. And also, using their healthcare insurance is assuming that children have mental illness. And sometimes they're just going through a difficult time. It's just at most adjustment, if anything else. And so that may not be the most proper venue for them. I think it's important for them to find someone who is comfortable testifying in court, first of all, and also someone who truly has the best interest of the child in mind, because sometimes in the process of the litigation, the children's need get overlooked, and then that's when they start acting out.
So my first takeaway from what you just told me is, number one, let's not go straight to the insurance provider to look for a practitioner because they potentially will not testify in court. And also it's making an assumption that there's a pathology or a diagnosis to be had. Is that accurate?
That's correct. I think usually some seasoned family lawyers actually might be a good source of who they might be able to ask, at least to begin with. And then, if their practice is full, maybe they can refer you to other people that they know could play such a role. And I think that will be the first place you can start. Another place might be through the court system. Sometimes judges might have a list of people that they know are good therapists and that have good skills and testify well that they can use. also.
So the word that you used earlier was forensic counselor. So is that a good word for clients to use when they're talking to potential therapists for their children, to indicate that is a therapist that will testify in court?
That's correct. Yeah. Forensic. I know a lot of people, when they hear the word forensic, they think about dead people. But I guess in this situation, it's more with regards to the legal system. And so, when children are going through this process of the divorce litigation, they do need someone who is trained forensically.
And in that forensic training, what are some of the things that you've been doing this for 30 years plus, that you think would be important for parents to look for in a therapist?
I think, first of all, they need to look for someone who is seasoned, clinically speaking. I think at least who have been practicing post-license for 3 to 5 years. I think it's very important for them to be seasoned so that they know what is normal presentation and what's not normal. And also because of their clinical experience and having seen more children in the process, then they become more aware of how different children of different ages, different cognitive developmental level presents themselves. And so they are more comfortable in being able to relate to them in a relaxed manner, and helping the children be able to tell what's going on in their lives and what's affecting them.
And wouldn't you agree that having a good rapport with that therapist is so important, so that you have that baseline of comfortable conversation and play?
Yes, I think it is difficult for children in this process because they love their mom and they love their dad. And sometimes by telling things that had happened to them, because one parent might have done something to them or to the other parent, make them feel like they're betraying that parent. So then it's a very threatening, scary process for them. They just wanted whatever happened to stop. They may not necessarily want to prosecute the other parent, but then in this kind of very tense, uncomfortable situation, unless they find someone that they feel comfortable relating to, be very hard to them to open up.
So if a parent is preparing their child for going into a new therapist and they're explaining who this person is, would you recommend that they give a lot of background, or just give just a little bit of information? And what would that be?
I think sometimes too much information to a child creates more confusion than anything.
Sure.
I think usually I would introduce myself to the child as a talking doctor. I'll just tell them that when you don't feel well physically, you talk to a physical doctor and the doctor will help you feel better. And I am a talking doctor. And when you don't feel well with your feelings, then you talk to me and I will help you feel better.
And so do you get parents that come in your practice who want to have meetings before and after therapy? And is that appropriate for the child?
I believe that usually before I meet any children, I would meet with parents, actually from both sides preferably. Of course, sometimes because one parent might have chosen me, the other parent then immediately got suspicious and didn't want to meet with me. But I actually do prefer to meet with both parents, but sometimes that's not possible. Usually helping children, I need feedback because sometimes I end up with the perfect patient that because she wants to be appreciated and supported and praised. So then they would come in trying to be perfect and everything is just fine. And they don't tell me what's really going on. Even though maybe the day before they just got into a fight or bite someone in school. So typically before the session starts, I'll ask the parents, is there something I needed to know? And that gives the parent an opportunity to tell me what's going on. I usually prefer if the parent tell me the story in front of the child. So the child would know exactly what mom has told me so that there will be no secrets. And at the end of the session, I will tell the parents usually that takes them that they will hear from me if they are part of the problem or part of the solution. And typically they are part of the solution, but sometimes they might be part of the problem accidentally. And then, or maybe they're just telling Aunt Susie what happened and the children overhear them. So then that's when I might have to tell mom that, hey, if you want to talk to Aunt Susie, I know that you're upset, but then perhaps you need to do it away from the earshots of the children, so.
So you talked about children sometimes presenting, trying to be the perfect patient.
Yes. Mm-hmm.
Do you ever experience children saying maybe words that are adult words that you think maybe came from another source when you're doing therapy with children?
Often. That's when I usually suspect some coaching might have happened, or sometimes children for no reason resenting the other parent. And when you ask them as to why, they would tell you adult questions like, because he doesn't pay. And when you said, what do you mean? And he will say, he doesn't pay the child support. And then you said, what is child support? And then they say, I don't know, I have to ask my mom about that one.
And then we have a conversation with mom
Yes.
after that therapy
Yes.
session, right?
Right, because whether a parent pays or not is a parental issue. It has nothing to do with the child, and I don't think the child needs to be dragged into it.
And so if I have a client who comes in with a child who's 3, 10, and 16, can they all go to the same therapist?
It depends. Some therapists are comfortable with very young children. Some are not. And very young children present a higher level of skills and challenge because you need to be adept with play therapy. You need to be able to adapt the way you communicate to their cognitive level. And because of their limited ability to express themselves, sometimes it'd be helpful to have paper and marker so that they can demonstrate. Kind of like one time I saw this young child and she kept crying and she just kept saying, Daddy's mean to me, Daddy's mean to me. And I said, what do you mean? And she couldn't tell me. So I pulled out some big sheets of paper and markers. And she drew an ironing board and an iron. And then tell me that he did this and using this, which is pointing to the iron on the finger when I don't listen. And then she started crying because I think it's hard for her to explain the ironing board. It's hard for her to explain, the ironing, burning the fingertips, and it's sad.
That's very sad. Mm-hmm. And do you remember in that case if you had an opportunity to speak with the father about that that picture or those series of pictures?
Yes, in that case, unfortunately, the father is not willing to engage, and I end up calling CPS.
And that's the hard part of your job, isn't it?
The difficult part. Yes.
So we kind of covered very young children. So that would be like a play therapy setup as well. Do you play games with the children as well as draw? Yes,
sometimes. And because playing is very relaxing for children, very healing. It provides them an avenue to release the pent-up tension. It also creates opportunity because children get relaxed and more open, and you can converse with them, and sometimes in the process of conversing you can give them helpful advice on how to cope with similar situation in the future, or what to say to the parent, and sometimes just by lending them a pair of listening ears to help them feel you understand and you care in itself already help them. Of course, with the older children, with the 6 years old and 9 years old, because of their higher ability to communicate verbally, sometimes we would talk more directly, versus play therapy.
And do you play board games with the children?
Yes, especially with the younger one, like elementary school years kids. And likewise, they feel more open and more relaxed. And when they just play and talk instead of just sitting down and talk, because, usually from children's experience, when they're asked or invited to sit and talk, that's when they're in trouble.
Oh, sure.
So that didn't, fits well.
Or it's just not that fun, right?
No, it will be very stressful for them. Yeah. And sometimes it's more relaxing for them if you play and do some other things. Yeah.
And so what phase in litigation do you recommend parents seek out a therapist, in what situation specifically?
I think, It's very helpful to get them in therapy even before the situation is filed, I think, for several reasons. Typically, the home condition it's rather tense. Some parents fight verbally, physically, out loud, and some parents fight very covertly with a lot of cold shoulders. But the children can sense the tension as thick, as a cake, and they can feel it. And so before the divorce even happened, there's a lot of tension going on, and the children probably needed help even then. Secondly, also, if they do that already, then they present less of a suspicion that, this mom's attorney is trying to just set it up to hire, some expert to come and improve the leverage for child custody. So there's more suspicion going on. And also it would also allow the children already having an established relationship with the doctor that knows what's going on, and during the process it seems natural for them to continue to confide.
Sure, to establish a relationship that's long-standing.
Yes.
and prior to litigation is what your preference would be.
Yes.
We talked about young children.
Yes.
And what types of therapy. So play therapy for young children. Is there a different type of therapy that you'd recommend for, let's say, a 15-year-old?
I think 15 years old would probably feel more comfortable just sitting down and talk. If you introduce toys or board games, sometimes they feel insulted, like you just, treat them as a small child, because at that age, they want to be very much feel like they are viewed as an independent person and want to be respected. And I usually would just sit down with them and talk about whatever has been on their mind.
And have you ever encountered a child, I'm sure this has happened, where they come in and they just won't talk and they're treatment resistant and they say, I'm not going to talk to you?
Of course, frequently. They
How do
bring
you
a stop
approach that?
sign on their face, and and sometimes you just go with their feeling and acknowledge their resistance, acknowledge they're unwilling to talk, and maybe even out verbally voice some possible reason why it's not comfortable for them to open up. And sometimes just by you showing that you understand how they are feeling and their complexity of the situation, their anxiety or their resistance, they actually open up.
So it sounds like empathy works a lot here.
Yes, because they do need to have somebody, at least a mature adult, that's rational, that's objective, that's caring, that they can go to. Their mom and dad might have been very nurturing prior to this divorce process, but in the process of a divorce, sometimes they are hurting themselves. They're in a lot of pain themselves, that they may not be able to be that patient with their children.
Well, I'm sure you've heard the term divorce crazy, right?
Yes.
And so a lot of my clients come in and we say, we have really good people on their worst day.
That's right.
And so they're not shining in that moment. But what I encourage my clients to do is put the oxygen mask on first for the mom or dad, and then you can help your child.
That's right.
So have you ever made referrals to the parents while their children are in counseling and say, hey, look how good Bobby's doing in play therapy. Maybe this might work really well for daddy.
Right. And sometimes it's successful and sometimes they're not, because sometimes the parents will feel like, they're already spending a lot of money on the divorce, a lot of money on their children, and sometimes even with other professionals that got brought into the picture that they have to pay for, and they'll typically say, oh, I'm all right, I got friends to talk to, and I'll deal with it later on, and which is a very polite way of saying no, thank you.
Sure. But I think mental health is one of those, you can't put a price tag on it. And,
Absolutely.
And especially when you're trying to model good parenting behavior for a healthy child going through this really tough process that can be months, if not entire years.
That's right.
So I'm so grateful that we have people like you in the community. Could you tell some of our clients and viewers, in a high stress, high conflict divorce, why is it important that the therapists are able to testify and tell the story of this child and give them a voice, or these children that you're counseling?
Mhm. Well, it's important because, first of all, children don't usually have the opportunity to go before the judge to explain their situation. And even if they were given the chance, a lot of them will be very intimidated. They might shut down, they may not talk. Or sometimes cognitively, they are not able to fully explain themselves.
Mm-hmm.
And so it takes someone who is aware of their developmental level, who is able to articulate for them how they're feeling and why they're feeling the way they feel, to explain to the judge or to the jury what's really going on. And so that's why it's important for them to find someone who is able and comfortable in testifying in court.
So a lot of times I get clients and they say, my ex-wife says this to my kid, and this is what I hear at home. Or she told this to the babysitter. And my response is, that's all hearsay. You can't get that in. It's not admissible. And if we're talking about specifically abuse or neglect or some sort of addiction that the child only is observing, that can only get in through the testimony of someone that's a forensic counselor.
That's correct. I think, to be a good forensic counselor, she first of all has to be well trained in assessment, and they need to be objective. Sometimes those situations might be caused by a misunderstanding, and so they are able to decipher between what is potentially a misunderstanding, what is potentially a coach situation where one parent is putting the child up to help her win custody for child support reason or whatnot, or what is true, genuine outcry for help. And being able to tell the difference because this person is well trained with assessment and well familiar with how a genuine outcry looks like, they are able to testify and be an advocate for the child very effectively in court.
So unfortunately, I'm sure in your practice, you've seen situations where children have been told to say certain things. So you use the word genuine outcry. What are the things to spot that illustrate or red flags for what a kind of a fake or suspicious outcry might be?
Yeah, I think certain things, like you mentioned earlier on, sometimes a child that use a very big word or phrases that you hear repeated by one of the parents, or they use words that when you ask them to explain, they could not do that. So that's one telltale sign. Another one is sometimes when the kids were given a task to do, they feel burdened. You feel like, they're ill at ease. They don't feel like playing. And then suddenly, they will blurt out this whatever important message that they were entrusted to tell the therapist. And then almost immediately, they feel a sense of relief. And then after they tell you, then they're back to normal and able to play. Okay, so then, you also see this real drastic change in their manner, in their mood, in presentations. And usually children who are truly traumatized have that very far away look. And sometimes they are not as willing to tell. But usually children who are coached are motivated to tell because sometimes they are promised ice cream or they're promised some gift afterwards. So they are very motivated to hurry up and tell you so they can get it over with, then they can play. And so, but then with children who are who has really gone through trauma, you would see this resistance, this unwillingness to talk about it. They would change the topic. They would look away. And sometimes after they tell, you can see tears welling up in their eyes, or they start shutting down and they don't want to play, or then they say, well, I want my mommy, or I want to go now, because they're truly not feeling good for having recalled whatever happened. So you can really tell from their demeanor what is real and what is probably not real. And sometimes children also tell inconsistent story if they're coached. And also children who are coached are not typically able to spontaneously tell you more details. because you were just told to say, well, daddy touched me in my TT. And then you just say, well, so what did he do? Can you show me? And they had no clue.
So it's like when an adult tells a lie and then they have to keep figuring out how to wrap that lie up in a pretty bow. So we were talking about severe trauma and how to spot that with children and how you treat it. I've had CPS kids. I've represented them as an amicus attorney and in different capacities. And they've actually told me, I love my mom. And you look at the records, and this mom is a drug addicted mom who's literally been in and out of, homes and apartments with different men who have abused the child and the mother. And they genuinely believe and they feel that they love that parent. So what's your opinion or what's your take on how to deal with a child who fundamentally feels that they love their parent, but it's not good or healthy for them?
It's a very difficult situation because children do have an innate love and unconditional love for their parents. Even though they might have gone through a lot, that's all they knew, perhaps. And in this situation, sometimes the expert would have to make a tough decision based on what is truly in the child's best interest, because the child really doesn't know better. But if the child has a very established, strong relationship with that parent, perhaps it would be good to set up some visitation opportunity instead of allowing them to be put through this, household to household, man to man situation.
Sure. So in your practice, I'm sure you see mistakes that happen, right?
Yes.
And what happens if someone goes out there and they just want to cut corners, they don't want to pay, they just go straight to their insurance policy and they just pick the first person on the list that can take them the first on the schedule? Why could that be a problem?
Sometimes it could be because typical clinical therapists, psychologists, counselors who may not be well aware of the forensic litigation process might not be as adept in scrutinizing what the children have to say. And sometimes they might blankly take what the children have to say at face value and then have the knee-jerk reaction, call CPS, and get this whole thing going. That can be harmful because that whole situation might have been caused by a misunderstanding. It could have caused by a child's misperception of a situation. The child could have been set up to been coached, set up to basically help a parent have an upper hand in the litigation. And also when they have this knee-jerk reaction of calling CPS, and CPS come out and found the story not to be consistent or believable, then it makes subsequent genuine outcry be ignored. And that's what I see sometimes, because then the parent could genuinely find something wrong later on, and CPS would sometimes administratively close it.
And sometimes what we see is if there's an overreaction with a new therapist or a therapist who is not used to the court system, it can actually change the entire trajectory of a case.
That's true.
And make it much more high conflict than it needs to be.
Yes. And it's also important to have someone experienced, because it's not uncommon for children who's going through a divorce and they're feeling very insecure. They might feel like they are losing the other parents that may not be primary parent. They have this need to please and to align themselves with the parents they're visiting. And so sometimes it's not uncommon for them to tell the other parent that they really wanted to live with them more. Or sometimes they sense the tension between the couples, the mom and the dad. And sometimes children would use that as leverage to get what they want. If the dad doesn't buy it for them, then they'll tell mom about it. Or sometimes they wanted to get aligned with that parent that they're visiting, so they would intentionally or not intentionally embellish small negative things that might have happened in the other household and carry tales. And sometimes that actually sparked the litigation, the mutual accusations, and ongoing years and years of lawsuits and thousands of dollars lost. Instead of spending on their college education, they spend it in court. And so that's why it's very important for a therapist to know what is common for children to do and what's not common. So that we will be able to truly act in the best interest of the child and not just creating more chaos and stress.
So I think, in summary, I think your points are amazing. Number one, get a therapist prior to litigation when you're sensing that that the marriage is over, or in a custody case when you feel that there's been a significant change and that child is acting up. Number two, don't go straight to the insurance company and go to the experts. Go to the judges. You can ask friends for referrals, but also make sure you get someone who's going to be truly a forensic counselor. And then finally, a good therapist like you can actually add so much value, because we're not going to blow things out of proportion and set this case on a trajectory that is going to potentially cost much more money than just those individual therapy sessions.
That's right.
I really appreciate you being here.
You're very welcome. I'm glad to be here.